Thank you. Good afternoon, everyone. I'm May. I'm the program manager of MAHA. The full name is Midwest Asian Health Association. Um, so obviously we are located in the Midwest of Illinois. Oh, next slide, please. Yeah, so here's the map. I'm showing you all that we are located in Illinois and Chicago. And on the right-hand side, the star located the neighborhood we are located in. Um, so MAHA is actually expanding a lot in recent years. So for now, we have 4 offices, and 2 of it is located in Chinatown, including our main office, and the other 2 are in like Bridgeport and a more suburban area because we're also wanted to take care of other like Asian populations resided in the suburb. But for MAHA, we were established in 2003, and our mission is to reduce the health disparities for like those medically underserved populations, especially Asian immigrants, those with lower income and lower education levels, or just those people with more disadvantages. Next slide, please. So I gathered some pictures and photos of Chinatown. As you can see this fancy big gate. You would see this if you once get down the subway and see Chinatown. This is like a welcoming gate for all the visitors. And of course, I put some like Chinese food because there are a lot of famous restaurants in the Chinatown, and this is also this is our main office. Um, it used to be another museum, but our director bought the museum and extended more space to serve the community. So as you might know, and in the similar situations like other organizations, the people we are serving has their own immigration background. They speak other languages. Like in this case, it's more like Chinese and Cantonese. And they might experience a lot of barriers to the healthcare. So in this mini grant, we really try different methods um, to merge the gap and try to educate them about TB or LTBI, and also provide different interventions to sort of help them to connect the needs they need. And in this slide, so I listed out the major points of what we've done through the mini grant period. So the biggest one is the workshops. So this is, we've conducted so many workshops during the 6-month funding period, and we reached a total of 197 individuals. So we actually did some homework of doing like where we should implement these workshops. So we realized the majority of the residents in Chinatown area are seniors. So seniors are usually the risk groups of TB, right? So we targeted some of the senior buildings. Those are like crowded with residents every year, and it has been in the community for so long. So we try to connect them and see if they have the opportunity to let us go and just have a 30 minutes, 1 hour education workshops. And also we contact other like elderly or low income apartments because we realize for those condensed like housing are also one of the factors to have TB. And then for the Chinatown Library, that's also we realize a lot of people in Chinatown, they they always go to the library. If they're like not, they don't have work in the weekdays, or they probably just, we would see like seniors and their caregivers, they just hanging out in the library because it's comparatively an indoor environment with the ACs on. So it just more comfortable compared to other places, and they feel safer in there. So we realized there were so many people hanging in the library, so we decided to have also like tablings and workshops in the library as well. And I feel like we really want to know like how many people we reached and whether they receive the information we want to provide, and it does facilitate them to do a testing or so, even though it's very hard to track on that. So in each workshops, we provide we give them a survey, a very brief survey, because in our past experience, if the survey is too long, they wouldn't want to complete it. So we provide a very brief survey just to collect some of the most basic demographic information and like some questions like, oh, what do you learn from today's workshop? Do you think you know more about TB? Those type of questions. And 90% of them strongly agree that their knowledge related to TB or LTBI has been improved, so which is nice. And also we highly emphasize the vaccine issue, because I know like the BCG vaccine might not be a case to other race groups, but to the group we are serving, the majority of them are immigrants from China or other Asian countries. They have BCG vaccine when they were born. So if they just get tested, like doing skin tests, they will get the positive result, obviously. So we want to let them know, make sure they had this type of knowledge, and in the future, if they have to do the testing, they know they shouldn't do skin tests, or they should like bring this up to their healthcare providers to let them know, I have this background, so what should I do next? And I remember like other organizations also mentioned this, like incentives is always a thing. Like whenever we want to do like community workshops, if you have like no incentives, no snacks or goodies bags, people might not that want to join, or they would just stay there and like listen to like 5 to 10 minutes and they think it's boring, they would leave. So we also like get the budget from other programs to make sure we can recruit enough people to stay and receive all the information we want to provide. And then for the providers training, we did it in a different way, like workshops. So we collab with local universities like UIC or Rush Hospital, and hospitals like Rush Hospitals and Rush University as well. We collab with the medical student to have them co-host those trainings together, because so we want to connect the content of these trainings to those potential healthcare providers of what like connect to those things that they were currently learning at school. So the medical students know what they're learning. They know how to attract their peers. So we sort of create the whole curriculum with them, try to make more connections to the courses they're currently taking, to make the trainings more informative. And so it was great. Like we reached 106 healthcare providers, which definitely includes like medical students, or physicians or non-physician, but also like healthcare professionals. And some of them are like community health workers, to make sure we provide these trainings to all the people who might exposed to LTBI patients or anyone who might need related help. And one thing I did internally of this provider trainings is that, because MAHA is a community-based organization, so a great amount of our work is that our navigators will help clients to apply for different public benefits. Like in Illinois, it's like Medicare, Medicaid, or our SNAP, or anything like LAHEAP, like utility bills, like those benefits. So I realized if we always promote workshops online or through flyers on the table, people may not like people, if they don't know what is TB or they just not used to joining this type of event, they may never come. So we educated and train all of our navigators to make sure they know the most basic knowledge of TB or LTBI. And we put some like information cards of where people can do TB testing or what are the 5 must-know facts of TB on their table. So when clients come to them and applying for other stuff during the waiting period or while there's like submitting those complex forms, they can take a look at those brochures or materials, and if they realize there's something they might be interested in, they can ask the navigators, and in some cases the navigators can refer them to us. Yeah. And then for the tabling and health fairs, there are so many like health fairs or events happened in Chinatown area all the time. People here are pretty active of holding these type of activities. So we try to have a table in all types of events. So includes like the health fairs in the Chinatown Library or the ANHPI cultural celebration in the Chinatown Square. And also like the food pantries nearby. We try to have a table there and provide those materials we have. Next slide. And in the World TB Day, we created a bilingual flyer to remind people how they can prevent TB. And also we collab with other local community organizations to host a health fair in Chinatown public libraries. And I delivered a brief, I think it was in Mandarin. Yeah, that workshop was in Mandarin, to give them a brief education of what is TB. And it was interesting that people were very quiet during that brief presentation, but afterward, because I stayed there for the rest of the tabling things and the health fairs, and people came to me and I realized they have a lot of questions, including like, oh, I just get my TB vaccine last month. Should I get one more this month? So I realized people still have questions about TB, but it just they don't know where they can reach to. So I'm glad that in this opportunity, I am a window that they can reach to and probably answer some of their questions. And next slide. So this is the AANHPI celebration event I mentioned on in May. So it was an event to celebrate AANHPI. So of course there are like fun activities, cultural performance during the same time. But the role of MAHA is that we have like at least 5 to 7 tables like have different health topics. So my tables, I'm like having Alzheimer's and also like TB at the same time. And then for the other tables, they also provide like health screening, like help people measure their blood pressure or like they just have different service at that moment. So I'm glad we attracted like hundreds of people come to this event, and I'm glad that some of them do want to know more about TB, and I have a chance to show them the materials and give them a brief education at that point. Next slide. So it comes to our lessons learned and some challenges where we were facing. So the first lesson I learned, because obviously I'm the person who's like creating all those interventions and the person implementing it. So the lessons I learned from the overall program life cycle is that the groups we are working with is the most vulnerable population with different immigration and vaccination history. So we always have to make sure that the lessons or the materials we provided were like tailored to what they need. And at the same time, we have to provide the interventions using their own languages. So for example, in our group, say speaks Cantonese or Mandarin. So obviously you cannot use English to provide the workshop because they wouldn't want to join because they don't understand at all. And also while we're creating those surveys or questionnaires regarding how their experience with the workshops, you have to make it as simple as possible. And I realize people in this community can be active with those celebration events, but might be hesitant to reach out health-related things because it might be due to like cultural issues. People might be embarrassed to mention their illnesses, or they don't think they want to make sure all the services they got is covered by their health insurance. So that may be a problem. Like whenever I mention, oh, if you have this or that, or if you're in the risk groups, you have to do like TB testing once in a while. And they were like, the very first question that happened many times, people ask is that, oh, is it covered by my Medicare? But this is not a yes, no answer. This is very complex. So I feel like that's a thing I always have challenging with because you don't know what's going on with that person. So you cannot just tell them, oh, it should be covered. We cannot guarantee that. Another lessons I learned is that we try to provide as flexible materials or opportunities to educate the community. So we try to distribute these information in multiple ways, not only like different language workshops, but also we try to create those materials, not like regular flyers, because people are so like tired of getting flyers. So we make it as a more compact sized testing card, like cards with those TB testing sites. So we merge those locations, phone numbers, and which testing they do in a very small card so they can just grab it in their pocket or their wallet. It's just easier for them. And one more challenges I have is that actually I contact so many senior buildings during the period. I do want to provide trainings to their staff members as well. Because I often got rejections because they said, oh, this is not a required training by Chicago or Illinois. There's no fee used. We can provide it. So they turn us down. So I feel like I know the Asian population in Illinois is not like the top 3 among the all United States, but I feel like if we want to make sure we got all the healthcare providers or related facilities to get trained to know what to do if they have residents experiencing TB or LTBI. It might have to be something including the regulation, or as a community-based organization, the only thing we can do is to provide these free services. But if we get rejected, then it might be a sad thing at that point. We have to try different ways to help the community. And that's all I have for now.